How climate change is affecting global health. Climate change is more than an environmental challenge. It's one of the biggest threats to public health today. As global temperatures rise, the effects on human health are profound, touching nearly every corner of the world and affecting millions of people in ways we're just beginning to understand. Let's start with heat. Higher global temperatures mean more frequent and intense heat waves. Prolonged exposure to extreme heat can lead to heat exhaustion and heat stroke, particularly affecting children, the elderly, and those with pre-existing conditions. In fact, heat-related illnesses are now a major cause of mortality during summer months in regions experiencing record-breaking temperatures. For vulnerable populations like outdoor workers and low-income communities without access to air conditioning, the risks are even greater. Then there's the impact on air quality. Climate change contributes to worsening air pollution, which is linked to respiratory conditions such as asthma, bronchitis, and chronic lung diseases. Higher temperatures increase ground-level ozone and worsen particulate matter pollution, which can irritate the respiratory tract and exacerbate asthma, especially in urban areas. According to the World Health Organization, air pollution from climate change-related factors causes millions of premature deaths each year, with children and the elderly being especially at risk. Another alarming factor is the spread of vector-borne diseases. Warmer temperatures and changing rainfall patterns create ideal breeding grounds for disease-carrying insects like mosquitoes. Diseases such as malaria, dengue fever, and Zika virus are expanding into new regions where they were previously rare, exposing more people to these serious health risks. In areas already battling these diseases, rising temperatures and increased rainfall create conditions that make it harder to control outbreaks. Flooding is another growing health threat tied to climate change. As sea levels rise and extreme weather events become more frequent, coastal regions are at a greater risk of flooding. Floodwater contamination leads to waterborne diseases like cholera, typhoid, and hepatitis. After floods, stagnant water also attracts mosquitoes, adding to the spread of diseases like malaria and dengue. Flooding disrupts sanitation systems and contaminates drinking water, increasing the risk of gastrointestinal illnesses in affected communities. Additionally, climate change threatens food security, which is vital to health. Droughts and unpredictable weather disrupt agriculture, leading to crop failures, food shortages, and increased food prices. As food becomes scarcer and more expensive, malnutrition rates climb, particularly in regions heavily reliant on agriculture. This malnutrition weakens immune systems, making people, especially children, more susceptible to infectious diseases and stunted growth. Mental health is also being affected. Climate-related events like hurricanes, wildfires, and droughts can lead to trauma, anxiety, and depression, particularly among those who have lost homes, livelihoods, or loved ones. The stress of rebuilding lives in the aftermath of such events, or facing repeated threats to health and safety, places an enormous mental health burden on individuals and communities. The message is clear. Climate change is impacting global health in profound ways. Addressing climate change isn't just about protecting the environment. It's essential for safeguarding human health. Reducing greenhouse gas emissions, transitioning to clean energy, and preparing health systems for climate impacts are crucial steps in protecting public health and creating a sustainable, healthy future for everyone.